At least 11 people were killed by Israeli airstrikes on southern Lebanon, making Saturday one of the deadliest days since a truce between the two countries went into effect in June. Lebanon's health ministry said a home on the edge of Ansar village was destroyed, killing 7 people, including 3 children. Another attack in Deir al-Zarani killed 4 people. The Lebanese prime minister criticized those attacks, saying they intimidate residents in their homes and undermine efforts to stabilize the situation in the south. We can cross now to Nabatieh and bring in Dr. Pierre Catoire, an emergency doctor and medical coordinator for the international health NGO MAHAD. Dr. Pierre, thank you so much for speaking with us today. So, what can you tell us about the humanitarian situation in Lebanon, especially in the area where you are?
Thanks for having me. The area of Nabatieh in the southeast of Lebanon is among the areas which have been struck the most during this conflict. The situation now, since the last 36 hours, are very concerning, given that it's the largest escalation since the trilateral agreement, which was signed at the end of the month of June. At the moment, the strike held like 3 kilometers from here on the hill surrounding and in the village. As you cited, there were airstrikes in Ansar and in Deir al-Zarani. We also noticed the large departure of most of the population here from Nabatieh. According to the doctors working here, many people and probably more than half of the population had to flee the Nabatieh and the surrounding villages. The strike also hit some of the healthcare workers themselves, and some doctors lost their homes just yesterday during the airstrikes.
Now, Pierre, what about Lebanon's hospitals and medical facilities? How are they holding up under the strain of these attacks?
Talking about generally the healthcare system, the healthcare workers are very concerned about possibilities of new attack because more than 200 attacks direct on healthcare system has occurred since the escalation in 2023. So all the staff, and especially the staff working in ambulances and in out of hospital context, are precisely concerned. We observed multiple times what we call the double tap tactic, which aims at targeting a first target and conduct a second hit, especially when the healthcare workers are taking care of the wounded. A second thing is that the trauma system in any country, especially in Lebanon, relies on the possibility to transport one wounded victim to another point. And it's especially those possibility of transporting the most critical patient, which is impaired by those conditions.
Pierre, you were mentioning there some of the challenges working in a conflict zone. What are the kind of injuries that you've been seeing when you're treating the Lebanese after one of these attacks?
So among the feedbacks we had from the Lebanese doctor who took care of those patients, multiple pattern of injuries, including blast, including compression, have been encountered. Moreover, on the long term, we observe that we have more concerning rates of infections of the wounds caused by the conflict.
And Pierre, what about the psychological impact? Because the prime minister earlier had said, look, these bombing attacks, they're meant to intimidate, to cause fear.
Absolutely. We observe a pattern of extremely high intensity um, activities by all participants, and we observe that those actors are targeting deliberately the mental health of the population, first by pushing the population to flee for population who already had history of multiple displacements, and secondly, some tactics, and especially the use of sonic blasts, which are caused by supersonic flights over the residential area, are deliberately conducted to trigger mental health harm for the population. So it's a deliberate tactic which we observe since the escalation and has definitely a strong impact on the health of the population.
And In the South, where the active conflict is ongoing, are there actually facilities that can help the Lebanese? And what about medical supplies? What's the situation there like?
So the organization is coordinated by the Ministry of Health in all areas and supported by first the national healthcare workers, second by national organization, and third by international organization, among others. The answer is all the actors are very strongly mobilized, but given the restriction of access, given the destruction of infrastructure, all that help cannot be enough to answer to this large increase, and especially on those recent days here.
So, Pierre, in light of that, do you think that Lebanon is getting enough support and aid from the international community? And what more needs to be done?
So the responsibility of the community is first, so of course, to bring all the support possible, and of course, not given the condition, the help present is still not enough. But the responsibility of the international community is first to act on cessation of the conflict and preventing a long-term conflict and a long-term occupation. This is the first responsibility of the international community, because of course they support the NGO as we are, but international community is not NGOs, and they have that responsibility that we cannot, of course, carry.
Pierre, thank you so much for taking the time to speak with us today,
Thanks for
and
having me.
stay safe there. That's Dr. Pierre Catoire, the medical coordinator for the international health NGO, MAHAD. Turning now